Tributes continue to pour in for 90s teen heartthrob James Van Der Beek. The actor died at just 48 years old after a battle with colorectal cancer. Now, he rose to fame in the late 90s as the star of the hit series Dawson's Creek. Now, for millions who grew up watching him, this loss hits close to home. It also comes at a time when health experts are sounding the alarm about colorectal cancer. And joining us now to talk more about the warning signs and what you need to know is Dr. Ada Graham, a colorectal surgeon at Johns Hopkins Cancer Center. Good morning to you. Thank you for joining us.
Hi, good morning. Thank you very much for having me.
Yeah, we appreciate you making time for us. Let's start with this. We've heard that colorectal cancer is now rising in younger adults. What are doctors seeing and why is this happening?
So colon cancer is indeed rising in early adults. We've been seeing this for the past 2 decades, which is why the cancer screening guidelines shifted a few years ago for a first screening exam at age 45 rather than age 50. And that's because overall, globally, colon cancer is the 3rd most common cancer, and it's the 2nd leading cause of death. For early onset, right now we see about 10% of all colon cancers are being diagnosed in people over the age of 50, with the predicted rise leading to up to 30% of rectal cancers in the next 10 years being in patients under 50, and in general colon cancer being 10 to 12%. The early signs of this, and this is something that people should not ignore, are any shifts in your bowel habits, and in particular, any new rectal bleeding. Please do not consider it a hemorrhoid. It does not have to have pain, and that's in large part because these earlier onset colon cancers also tend to be at the end of your colon, such as the rectum, and that area will oftentimes present with painless rectal bleeding.
So we hear this conversation a lot, especially with men. I know a lot of my friends talk about this. What do people need to know about a colonoscopy? What should they know? Are there other screening options? Because they say, oh my gosh, this whole experience has been so awful, and they tell other people, and then they're like, oh, well, I don't want to go through that. So you dig into that a little bit and talk about some possible other options if that's an actual reality.
Absolutely. So a colonoscopy is still considered the gold standard. It's the most sensitive, and unlike the other screening options, which are CT colonographies and the ctDNA, that Cologuard test people hear about where you send a sample and they check for tumor DNA, a colonoscopy can also remove polyps before they get a chance to turn into cancer. So for anyone who has a high risk of colon cancer, so any family members who have had colon cancer, siblings, parents, a screening colonoscopy is definitely the best option. However, for people who are reasonably concerned about having a colonoscopy due to the uncomfort with the bowel prep, having to clear out the colon full of stool, then the 2 other options we have are a fecal occult blood test. However, that needs to be checked every year, or the ctDNA. That's the more recent one you may have seen advertisements for, normally called Cologuard, and that needs to be done every 1 to 3 years. Now, these tests do not find early polyps. They are looking for larger polyps that could be turning into cancer or cancer.
All right, some good information there. And real quick, before you go, if you have found something in the past, what should the screening period be? 4 years, 5 years for the next screening?
Great question. So it depends what is found, but typically it's in 5 to 7 years. If there are multiple polyps, then it may be in 3 years.
Okay, 3 years. All right. And as far as the solution is concerned, any way to work around how nasty that solution is? I know you got to go through it, you got to drink it. Is there any way around that?
So I normally recommend for folks putting like the flavor packets in, like you would put in seltzer water or a soda stream. Just something to make it taste a little bit better. We also do now have some tablets that you can take instead, depending on how you've done with previous preps. But unfortunately, it is diarrhea to get ahead, but tentatively catching an early cancer when it's caught and curable is worth the benefit.
Yes, and you know what? That's that nasty taste is a small price to pay for catching something that's very serious. Dr. Ada Graham, a colorectal surgeon at the Johns Hopkins Cancer Center. Thank you very much for the information and the insight. We appreciate you. Have a great day.